In the hidden chambers of our bodies, there are silent invaders growing, spreading their tendrils into the vast network of our organs and glands. They are the carcinoid tumors, a rare and mysterious form of cancer that lurks in the stomach, hijacking its host by secreting hormones and triggering a cascade of symptoms that extend far beyond the gut. Imagine a hidden tumor in your stomach that doesn't just grow silently. It attacks your body by releasing hormones that trigger symptoms far beyond your gut. Imagine the confusion, the fear, and the frustration of living with these symptoms, not knowing what's wrong. This is the reality for many who find themselves battling this rare and enigmatic form of cancer. Welcome to my channel. Today we're diving deep into the world of carcinoid tumors, exploring what they are, how they affect our body, and why they are such a formidable foe. If you're new here, click the subscribe button so you never miss an upload. And if you enjoy this video, be sure to hit the like button. What are carcinoid tumors? Picture a microscopic battleground where hormone-producing cells in the digestive tract turn rogue, forming a tumor that not only grows but also unleashes a chemical warfare on the body. That's what carcinoid tumors are all about. These fascinating yet formidable growths are a type of neuroendocrine tumor net, which means they combine characteristics of both nerve and hormone-secreting cells. While most stomach cancers aggressively destroy surrounding tissue, carcinoid tumors stand out by producing and releasing an array of hormones, including serotonin, histamine, bradykinin, prostaglandins, substance P, and more. These chemical messengers then travel through the bloodstream, triggering a series of events that can affect various organs and systems throughout the body. Where do they grow in the stomach? Think of your stomach as a complex, dynamic organ responsible for much more than just digestion. When carcinoid tumors emerge, they typically take root in the upper reaches of the stomach, specifically the fundus body. Interestingly, research suggests a link between these tumors and two specific conditions: chronic gastritis and pernicious anemia. Additionally, a small percentage of carcinoid tumors are associated with a genetic disorder called multiple endocrine neoplasia, also known as MEN1 syndrome, Zollinger-Ellison syndrome. Together, these factors paint a complex picture of what might drive the development of these unusual growths, how they cause trouble, the hormone-secreting chaos. Now let's explore how carcinoid tumors wreak havoc in the body. Here's a closer look at their insidious tactics. As these tumors grow, they release a cocktail of hormones into the bloodstream. This hormonal onslaught can lead to a range of symptoms collectively known as carcinoid syndrome. But that's just the beginning. These tumors don't just sit idly by. They actively work to evade detection, making their presence even more insidious. Let's break down the key aspects of how carcinoid tumors cause trouble. 1. Tumor growth and spread. Carcinoid tumors, while usually slow-growing, have a knack for sneaking around the body, often remaining undetected for years. As they expand, they can wrap themselves around vital structures, making removal tricky. Plus, they have a sneaky way of spreading, traveling through the circulatory system to distant parts of the body, particularly the liver, lymph nodes, and bones. 2. Hormone release and carcinoid syndrome. The real trouble starts when these tumors begin releasing a mix of hormones into the bloodstream. The main culprits are serotonin, histamine, bradykinin, and prostaglandins. This hormonal cocktail can lead to a range of symptoms from flushing of the face and severe diarrhea to wheezing and asthma-like symptoms. But the problems don't stop there. These hormones can also cause damage to the heart valves, leading to a potentially life-threatening condition known as carcinoid heart disease. 3. Impact on digestion. While not directly related to hormone secretion, the location of these tumors in the stomach can directly impact digestion. As the tumors grow, they can obstruct the flow of food through the digestive tract, leading to feelings of fullness, nausea, and abdominal discomfort. 4. The challenge of early detection. The size and growth pattern of carcinoid tumors pose significant challenges for early detection. Often small and slow-growing, they can evade detection for years. By the time symptoms become apparent, the tumors may have already spread, making treatment more complex. 5. Overlapping symptoms. The symptoms of carcinoid syndrome can mimic those of other conditions, such as irritable bowel syndrome, asthma, or even anxiety. This can lead to misdiagnosis or delayed treatment. Why they're so hard to detect. Now, let us delve into the reasons why detecting carcinoid tumors can be akin to finding a needle in a haystack. 1. Size and growth rate. These tumors often start small and grow slowly, which allows them to hide for years without being noticed. 2. Location in the stomach. The nonspecific symptoms associated with the early stages of carcinoid tumors can easily be mistaken for other common digestive issues. 3. Nonspecific symptoms. As mentioned earlier, the symptoms of carcinoid syndrome overlap with those of various other conditions, making it challenging to pinpoint the actual cause. 4. Lack of awareness. Carcinoid tumors are relatively rare, which means that many healthcare professionals may not be familiar with their presentation and unique challenges. 5. Diagnostic challenges. Obtaining a definitive diagnosis requires a combination of endoscopy, biopsy, blood tests, and imaging studies, such as Octria or GA68 PET scan. These tests can be complex and may not always be readily available. Treatment options. When faced with a carcinoid tumor diagnosis, patients typically explore several treatment avenues. Here's a breakdown of the common approaches employed. 1. Surgery. Surgical removal is often the first line of treatment, especially when the tumor is localized and detected early. The goal is to remove the tumor while preserving as much of the surrounding healthy stomach tissue as possible. However, due to the potential for carcinoid tumors to wrap around blood vessels and other structures, the procedure can be technically challenging. 2. Medical therapy. When surgery isn't feasible or the tumor has spread, medical therapy becomes crucial. One class of drugs commonly used is somatostatin analogs, such as octreotide and lanreotide. These medications help block the release of hormones from the tumor, helping to alleviate symptoms and slow tumor growth. Another treatment option is targeted therapy using drugs like everolimus. This approach focuses on specific molecular pathways involved in the growth and spread of carcinoid tumors. Peptide receptor radionuclide therapy, PRRT, is also gaining prominence as an effective treatment for advanced carcinoid tumors. This therapy combines the precision of targeted drug delivery with the power of radiation, offering a more focused and personalized treatment approach. Finally, chemotherapy, while not the primary treatment option, may be used in cases of aggressive type 3 carcinoid tumors. Living with carcinoid tumors can be emotionally and physically draining. It's essential to be prepared for the challenges that come along with managing this condition. Here's what you should know. 1. Regular follow-up. After initial treatment, regular follow-up appointments are crucial. Carcinoid tumors have a tendency to recur, and monitoring for any signs of regrowth or spread is essential. 2. Watch for recurrence. Even if treatment has been successful, carcinoid tumors can remain dormant for years before recurring. Being vigilant about any changes in symptoms or overall health is important. 3. Nutrition tips. Certain foods and drinks can trigger the release of hormones from carcinoid tumors, leading to symptoms like flushing. It's often recommended to eat small, frequent meals and avoid potential triggers such as alcohol and spicy foods. 4. Emotional support. Dealing with a rare and sometimes misunderstood condition like carcinoid tumors can take a toll on mental health. Connecting with support groups or therapy can help process the emotional challenges associated with the condition. Why is it important? Carcinoid tumors may be rare, but their impact is significant. Understanding these tumors is essential for a few key reasons. 1. Rising incidence. Despite their rarity, cases of carcinoid tumors appear to be on the rise. This trend highlights the need for increased awareness and research to better understand the factors contributing to their growth. 2. Common misconceptions. Many people with carcinoid tumors often have to deal with misdiagnoses or delays in diagnosis because the symptoms are commonly linked to digestive disorders like irritable bowel syndrome. 3. Symptom management. Recognizing the unique set of symptoms associated with carcinoid tumors is crucial for timely diagnosis and effective management. By understanding the typical symptoms, individuals can better advocate for themselves and seek appropriate medical attention. 4. Rare disease awareness. Carcinoid tumors are a prime example of a rare disease. Raising awareness about these tumors can help bridge the gap in knowledge among both patients and healthcare providers. 5. Research and innovation. Increased awareness and understanding of carcinoid tumors can drive research efforts, leading to the development of new and improved treatments and ultimately better patient outcomes. Now, we want to hear from you. Have you heard of carcinoid tumors before watching this video? How do you think it was portrayed? Feel free to leave your thoughts and any questions you have in the comment section below. We value your feedback and insights. Also, please don't forget to like this video. And if you'd like us to make a breakdown video on carcinoid syndrome, showing exactly how hormones wreak havoc on the body, let us know in the comments. Thanks for watching. Stay curious.